All right, so in our office, we have our doctors, myself, this is the way we've been trained to look at things. We look at a case history and we're like, okay, when did this start? Did you ever have an injury? Did you ever have an injury to your neck? Did you ever have an injury to your vagus nerve, which really is cranial nerve 10? It's part of the brainstem, but it runs the parasympathetic nervous system, which runs your urination, defecation, hormones, blood sugar, blood pressure, kind of important nerve. Have you ever had a concussion? Did you have a chronic illness, such maybe you had strep like 6 times, or we have people that have a lot or recurring UTIs, or Lyme disease, or cytomegalovirus, or Epstein-Barr, and maybe they don't have it anymore, but they've been treated for it. So these organisms can sometimes leave behind a toxin. And these particular toxins, let's say it's mold, it's called a mycotoxin, but other bacteria can leave other toxins. And how we describe it in the office, again, my 13-year-old adolescent male comes at it. It's okay, we have a dog that came through your yard. It did its business. It left poop. Okay, the dog's not there anymore, but poop's there. Well, your body doesn't deal well with fecal material inside of it that's not its own. And that's really what, if you've ever heard of like dust mites, it's not the dust mite, it's dust mite poop that you're allergic to when people have it. And I'm just getting to the nitty gritty of what's going on. So a lot of times the poop that the organism's left behind. So for instance, in the case of Lyme, because the literature is overwhelmingly showing that people are being overtreated for Lyme. Over antibiotic, in other words. So then they kill their own microbiome, and then they perpetuate leaky gut, and then they get other conditions and other dysfunctions that come from this. So let's say you had Lyme disease, and it happens. There's enough of it, and they got killed. And it was killed properly. I mean, let's say it doesn't matter, like less than like 10-15% of the cases have a bullseye rash. Everybody else gets it, and they don't have the bullseye rash. Unlucky for them. Bullseye rash is somewhat diagnosis, but it's not required, and it's not in every single case. So they went through all the treatments. They did everything correct. The doctor, in this case, a medical doctor, would have done everything to kill an infection because it was a opportunistic infection. It shouldn't be there. Totally on board with that. All right, so now it's gone. And then let's say 3 years later, this is when they typically go into a functional medicine office. I got a cold, everything that hurt. So let's say I had joint pain, my knees hurt, my back hurt, my head hurt, whatever it was, or I get dizzy again. My Lyme's back. I'm having every single symptom of everything that came along. Well, the antibiotics went through the tissue and killed everything that was supposed to be there. Now, I granted there are some very hidden infections, something that's very, very deep in the tissue. I'm not suggesting that not every case has been killed from an antibiotic from Lyme, but for the most cases, probably in the 90th percentile, they are. So we're looking at 9 out of 10 people that walk in with recurring symptoms, not the bizarre case. It's not a recurring Lyme. It's what's called these haptens and epitopal spreading pieces, Lyme poop, that has been left behind. That when you have a new immunological response, a cold, a strep throat, a virus, it reactivates the antibodies or the inflammatory response that the poop left behind, and you have inflammation. So in a lot of these cases that do come in our office, it's not the second, third, fifth, 20th time that they've gotten Lyme, and they haven't been adequately treated. They've actually been overtreated. And so we get to find out what's going on with that chronic infection. It's not usually a chronic infection. And again, too many doctors, and it doesn't matter if it's medical or natural, are just fighting this infection. And it really started in the 1940s. There was such a thing called a white coat syndrome. And it really came around with the discovery of penicillin and sulfa. Let's put this stuff on everything. We're going to kill everything. But there's an effect that comes with it. And in the, and we know that if you use antibiotics too much, you're going to destroy your microbiome, and your normal bacteria then aren't there. So you get overgrowths of candida and other things that can be opportunistic in there. We, in the past 3 years, too many people, what did we do? We washed our hands, we covered up everything. We had no exposure to things that help support our microbiome and keep things going. During that time when we weren't getting exposed to too many people, I sent my dog outside to go play in as much mud as she possibly could. And then when she came inside, we played wrestle. And I wrestled her down before we cleaned off her paws, and I was getting exposed to different things because I was trying to help my microbiome with exposure, because you're not getting the social interaction that you're supposed to have living on your own and being socially isolated is not good, but it also destroys your microbiome, not being able to do things. So overwashing, overkilling, over cleansing effects, and this is where so many kids today. I mean, there might have been a peanut allergy when I was a kid. Granted, I'm almost 50. There might have been. I don't recall it. There wasn't autism. There was food allergies. I mean, this gluten and dairy stuff didn't exist. We ate it all the time. What happened? Well, there's a change in food. There's a change in dietary, what we get to have. We get a change in what was being sold to us. We have a change in the environment. What's considered healthy, what's considered not. I mean, on one side, Roundup helps food grow, but then it has an effect on how the food is processed in your body and what it does. There are cellular disruptors of things that go in that didn't exist 50 years ago. I mean, there's a lot of things that happened. So even in the natural medicine side, a lot of doctors are like, I got to kill this candida, this parasite, this hemoth, this nematode, this parasite, whatever's going on in there, and we're going to do there. But why do they have it? Is there really a basis in their immune system that's being missed, and or that you're trying to support or supplement for and be part of for it? And I don't think everybody in that world is sinister or in their own financial gain. They at some points I feel like they do charge way the heck too much for some of those things. But here's what it comes down to: when we're talking about chronic digestive issues, chronic immune stress, chronic infections, or the potential of it feels like an infection, because sometimes, like I just said in the Lyme case, it may not be. It just might be exposure to something else, and you just happen to have damaged tissue, and it has inflammatory responses that goes along with it. Okay, so if you had a traumatic injury, you lost consciousness, you had a traumatic brain injury, you got hit from behind in your car, you fell off a bike, you fell off a horse, you fell down and hit yourself, you lost consciousness, those are considered traumatic brain injuries. Now, if you're a kid, 3-4 years old, and you have one of those episodes, you have a higher amount of what's called BDNF, brain-derived neurotrophic factor, and they generally are okay and they recover. But let's say you're over 12, 13, 14. You're a young girl and you're already starting your menarche, you're going through cycles. Or you're a young man and your voice started to change and it came down. Well, you're having less and less BDNF because you're starting to mature into a physiological adult. Now, granted, I'm not saying you should vote or drink or rent a car or drive or fly a plane. I'm not. That's not it. But neurologically, physiologically, you can reproduce, and that's just the way that things happen. So they don't repair the same way. And sometimes these people get what's called microglial priming. It's primed. So the next time that they get an infection, so we've had people that had concussions or got hit by a car, and 6 months later they get the cold or the flu, and all of their concussion symptoms come back. That's a big deal. That's microglial priming. Their brain is primed. Well, people get priming in your immune system, and by the way, microglial is part of the immune system in the brain, and they get inflammatory responses or feelings of inflammation and swelling that feel like it's been reproduced. So if I see, again, history of what happened and when did they get sick? Did you have a loss of consciousness, football or car wreck or anything like that, and then you were diagnosed with HASHIMOTO'S or rheumatoid arthritis or anything like that? Did you have this and you're diagnosed with a parasite? Did you have this and you're diagnosed with candida overgrowth or a mold toxin? If your brain doesn't work and it's not firing right, your immune system isn't going to work. So you're going to have chronic infections? Of course you are. So just staring at the infection, if it's life-threatening, got to do something about it. I'm not questioning that. But if you have an infection and nobody's staring at why your immune system isn't dealing with it again and again and again, you're in the wrong place. If you have a lack of being able to digest, and you're taking all these digestive enzymes and nobody's looking at how your brain works or making sure that their neurological conditions are correct to allow you to digest, or there's microglial priming or something else, you got to do something else. And so this is where, not a soapbox, I just feel like I do entertain myself and go look on some social media, whether it's, it doesn't matter where, and I look at the functional medicine doctors, and well, if somebody's doing a good job, guess what? I reach out. I say, you're doing a great job. I'm not here to be a patient or anything like that. I think you're doing great. I don't say anything to the doctors I don't agree with, but there are, I think in the alternative world, there are too many that are on a soapbox of let's kill everything that should that we find that shouldn't be there. And part of it, there's such a thing even called biofilms, which in the microbiome, maybe these, let's say, a lime, it puts out a film and it's supposed to protect itself. So kind of like, if a caterpillar makes its own little cocoon, that's the biofilm to that, and then it becomes a butterfly and it goes out. Well, if you have butterflies in your body, it's bad. Well, some of the research that's come on with the biofilm, it may actually be a good thing. Some of the research that's come out on parasites is, you look at, I'm going to call them out, a place in the world, part of Asia, India and Pakistan, not that they're friends, I'm not trying to start any fights with anybody there, but look at the cases of autoimmunity. If they live there, not if they come to the United States, it goes up, but if they live there, it's not as clean as it is here. There's more parasites in the population, not that granted they have more, so we're not looking at that by percentage of the population, but how much autoimmunity they have, it's not even close to what they have here. So there is benefit in a lot of cases where parasites have been beneficial to keeping the autoimmunity at bay, and part of that is the biofilm that's there. So if you move those things, you can actually increase, it's what the new research is kind of showing, increase more autoimmunity or polyautoimmunity. So looking at what's going on with somebody, looking at their chronic infections, we rarely anymore run stool samples. We rarely anymore run food sensitivities because it's a nervous system issue that's causing it in most of the cases that are walking in the door. If somebody went on a mission and they came back and they're sick and they're awful and they don't feel well, chances are we probably will run a food sensitivity in a stool sample because they went somewhere of places they ate and things they never were exposed to, and that probably changed their immune system that way, but they didn't. The majority that we see is we look at history and go, well, did you hit your head? Did you lose consciousness? And those are the cases that are chronic complex, that are hopping in, or we see in our office more and more these days. And I don't know if it's just why we're drawing that particular case, but if you're one of those cases out there, whether you see me or not, I hope and I pray that you find somebody that looks at it that way to see if they can help you function that way, because you got to get that nervous system working to get the immune system firing. It's who runs it. It's not the immune system that says, hey, nervous system, give me this or that. There is some communication back and forth, but the other thing that we see with these chronic complex autoimmune cases is that a lot of doctors jump into liver cleanses or harsh cleanses. They could be a detox, they could be a circulation, they could be IV therapy and things like that, and that's not, in other words, that's not what's showing up as beneficial clinically or in the research. And the worst thing that can happen is somebody gets worse. And when somebody feels worse in our office, they should not. You should not feel worse to get better. That's not a response. Now, some people just have reactions, or let's say they've been eating gluten for 20 years and they know they're gluten sensitive, and then they finally come off it. They might feel worse because their body is going through an adaptation phase. To be able to explain these things and what's going on, that's one thing, but you shouldn't feel worse for doing things. Understand that there's some changes physiology, but that's not how it goes. So to give chelations and other things that are pretty harsh, especially when somebody is reactive to the world, or they have mast cell activation syndrome or dysautonomia or a consistent leaky gut or something that they can't deal with any extra stress, because that really is a stress of the body, which then throws into another autoimmune flare, or really they have polyautoimmunity, and the flare you didn't know that an autoimmunity that they had is maybe not a very good idea. I know they're out there. I just want people to be safe, and I want them to be healthy. Or if they're not as healthy as they want to be, they can at least do the things that they can to help manage their health and get better. If you'd like to learn more about our office, go to choosenewleaf.com. I'm Dr. Alan Trites. Be well.